the next skill, you are going to first do a basic hand wash. This is not your surgical scrub, so just a regular basic hand wash. After we do our hand wash, we're going to go into the OR to start opening supplies. So make sure that you have your scrub hat and your mask on because you're going into a room that is going to be sterile. Okay. So now we're going to go in here. I have all of my supplies set up here. So first I'm going to check the integrity of all the packages, make sure that there's no holes. Okay, and then I'm going to start opening my supplies. So I'm going to pull that away from the wall so that I don't accidentally contaminate. Make sure you come to the end of the table, grab one side or each side with both hands, pull straight out, and then drop. Make sure that you're not leaning over the table, make sure you're not straightening anything out. You'll come to the other side and do the same thing. So now my back table is open. I'm going to open my basin. Make sure that you're allowing enough space in between your areas there. So open that side. And now I have my basin and my back table open. Then I'm going to start opening my supplies. This is a drape. I wasn't sure if the drape that we had in this pack was going to work, so when we're opening all of our drapes, it's just like when we open the towels, we hold right here, make sure that this pulls out, comes into our hand. And then just toss it on. All of my supplies are in here. Make sure that when you're opening, you're staying at least 12 inches away from your sterile field, and then throw your trash in the trash. Your nurses don't want to pick up your trash off the floor or off the table. Remember, there are two different ways that you can open them. You can open them the way I was opening those suture, or you can open them straight out like this, and then just toss them onto the floor like that. Hopefully toss them onto your table. If you do drop something on the floor, make sure you do not pick it up immediately, because once you put your hands on the floor, they are dirty. And you will have to go rewash your hands. And since I just did that, I'll wash my hands again. Or you can Avogard or use hand sanitizer, whatever you need to do. And in the OR, you will see scrub techs that don't do that. It's best practice. Remember that on the inside of your package, it's a 1-inch boundary of what's sterile and what's not. So see, it's not just you guys, even I will launch things over the table. As long as I don't pick them up and try to put them back on the table, they are not contaminated. I'll just get a new one. This one is contaminated because it slid over the side, so I would not use that. In the event that I was doing my lab final, I would just say, this is contaminated, I need a new one. And me or your circulator will get you a new one. When you're opening your blades, when you have to do that, be careful and make sure that you are not contaminating these. These are more difficult to open. And then also when you open them, make sure that you put them where you can see them. Don't cover it up with something else. So now I'm going to grab the things that I've dropped. And then the long bovie on the back, I don't have another one that's packaged, so we're just going to leave that, and then I need one more needle. So now all of that is picked up. Now I can come back and I have to make sure that I'm still keeping that 12-inch distance between me and the top of the table. So I'm going to pick up the things that I've dropped. This one will be a little more, these things will be a little more tricky, so I'm going to move that out of the way. I'm going to hand sanitize. Since I picked that stuff up off the floor. And then I'm going to open my instrument set last because I had everything else kind of placed on there. The patient wouldn't usually be in the OR, so we use our back table to open off of a lot. That is all set up, and then I will open my gown and gloves. So now I've opened up my gown and I've set up my sterile field for that. And then I've got my gloves set up on there too. So now everything is open. This is the end of skill 2, and you are ready to go do your scrub, gown, and glove.